I'm going to talk about, well, the talk is called Tools to Improve the Performance of African Swine Fever Surveillance in 3 countries. This is part of the case studies for RISKSUR to develop design-specific components and also for the evaluation-specific components in relation to early detection. Why did we choose African swine fever? Well, because it has serious and irreversible consequences. This is a historical perspective of what the last outbreak that big outbreaks that we had in Europe that was in the 1960s up to the 1990s. At the time there was no vaccine, and there's still no vaccine at the moment, and the eradication was achieved either by total depopulation in those areas where wild boar was not affected, or it took a very, very long time when there was a wildlife implication as well. And the only tool we have to fight this disease, other than very lengthy control efforts, is actually early detection. Today, the situation we have with genotype 2, that it spread from Africa to the Caucasian area and from there to Russian, and now it's spread into the European Union. We still have no vaccine, and the eradication efforts are actually, I mean, not the eradication efforts, but the eradication is quite far away at the moment. It's still circulating, it's spreading, and we can kind of separate in 5 different scenarios depending on the information that is available and on the different control options. So we have the Caucasian, the Russian Federation, Ukrainian, and Belarus constitute another scenario. Is this working? Here. The European Union countries, and we still have African countries where all the 22 genotypes of African swine fever are present. So the way I have structured the talk is to actually compare what was done in the European Union before the African swine fever entered, and what we think would improve the performance of early detection of African swine fever. So some of the surveillance components that were mentioned at the time, it was thought that the main route of introduction was going to be illegal introduction. So there was a lot of effort put in inspection at border inspection points of the personal luggage, or cleaning and disinfection procedures, for example. There was also testing of meat products and so on. And then it actually was introduced through wild boar. So the attention focused mainly on wild boar components, sampling and testing dead or sick wild boar, sampling and testing hunted wild boar. Now, the European legislation also contemplates sampling and testing suspect pig holdings. And this is quite a bit a key, one of the key elements, because what is a suspect pig holding? A suspect pig holding is one that presents clinical evidence, an epidemiological link to an ASF positive, one where there is practices of swill feeding untreated, probability of exposure, or presence of vectors. Now, I think the key here is the probability of exposure, and I will explain a bit more. So the first thing was that the African swine fever tests were carried out only in symptomatic and dead animals. And this part of probability of exposure is the most tricky part. What we think is that for the establishment of the compartment, for the establishment of the components, rather than starting by focusing on what is the target we want to aim at, is to actually look at the threat, because for early detection, this is really what is going to determine what actions to choose from in the surveillance design. So to look at the distance to ASF outbreaks, we would rather say to look at the distance to ASF threat, because even though ASF is a notifiable disease, there are many other, there are many situations where there could be either underreporting, or actually you could get more information from risk factors, a part of official notifications only. It would be much more informative. So to evaluate the level of African swine fever threat, we think that countries should consider not only that they are geographically close, but also if they are socioculturally close, if they are close by trade, environmentally close, or connected through plane or boat. That is quite relevant for ASF epidemiology. So with this, it would constitute the evaluation of the level of ASF threat. As I said, one of the most important is to evaluate that threat at origin. And that is constantly being ignored, in my opinion, in our experience throughout the surveillance plans. And also to identify those routes of introduction. So the next question would be where to look for. So this is how it looked, the identification of risk areas in some of the countries that unfortunately had outbreaks in 2014. And what they have in common is that they are bordering infected countries. I mean, all of the areas that are considered at high probability of exposure are located bordering these infected countries, and the surveillance was being carried out only in those areas. So what happens is that when outbreaks have happened elsewhere, these areas are being shifted constantly after the occurrence of the outbreaks. So we propose that the evaluation of the routes of introduction and spread are assessed for each administrative unit or disaggregated in the country, so we could have actually a mapping for the whole country. That the routes of introduction can be assessed according to country-specific scenarios. And we would be aiming to reply to questions like what is the probability that at least one infected wild boar survives, moves and enters, for example, for analyzing this route, or what is the probability that wild boar hunters transport the virus. Also, I mean, this is known, this is, I guess, known for everybody in this room, but we have to mention that it's the evaluation of transport until the destination, and then it would be the evaluation of exposure and consequence at destination to complete the where to look question. So there are plenty of tools to do this. I mean, and I'm not very sure how many of them are being used or why would they be used or not. I mean, one, for example, is the suitability map to map the population at risk and the factors that favor the spread and the maintenance. For example, we've done this with wild boar because the thing is that when we consider early detection, people are also thinking, well, for early detection, your prevalence is very low. But actually, if you consider it as not a border with permeable borders, like you could get this kind of picture, you can actually consider your threat at origin and also see what is your threat at a destination. So, as I mentioned, there's plenty of tools available that I'm not going to talk in detail about. There's quantitative, qualitative, semi-quantitative, but actually, I think we are probably a step behind. I mean, the exploratory tools and understanding the epidemiology of the disease are equally important. So, yeah, I mean, in our opinion, there's still a lot of work to do to get to the how to look for ASF question. That would be one of the parts where we could also be influencing. So, for example, these are true sentences, I mean, that have been read in international dissemination documents. The short viremia and high mortality associated with ASF make it virtually impossible to detect the disease through active surveillance. Now, these generalized concepts lead to a misconception of the disease epidemiology. This is not taking into account the source of the virus, is not taking into account the different routes of introduction of the virus and how the quantity of virus differ for each of the routes of introduction, and how that interacts with your susceptible population that is going to give a different, for example, clinical picture. So this was seen very clearly at this early detection scenario at a high biosecurity farm in Lithuania, where the expected high mortality and acute phase of the disease was not suspected until the 21st of July. Now, when this farm was investigated, the actual mortality peaks in the different weaning, fattening, and sows unit didn't show a differing picture that could expect what was going to become. And also, there was the finding of seropositive animals. So not only virus-positive animals, but also seropositive animals that made the expert estimate the date of infection 20 days earlier. And during that time, there had been pigs for slaughter that was shipped to other EU member states. Now, this scenario is real and it's still happening, and we are still not being protected against it. So the other one is, this is another real statement that has been said: the number of found dead animals and number of wild boar sampled and tested prove the high efficiency and efficacy of the passive surveillance in the early detection of ASF. Now, what happens here is that the efficiency is being measured by the number of samples taken rather than by evaluating a high level of performance relative to inputs. I mean, we cannot debate on whether it's active or passive surveillance, on to choose between black or white. I mean, it's really what is performing better. What combination can we get to actually find the disease earlier and find the majority of cases? So, of course, for early detection, time is the most important thing to timely detect, so that the costs do not go very high. And one thing that we have to take into account, and that it's different from disease to disease, is the probability of the source being infective. Now, this will depend on the epidemiology of the disease. There will be different amount of virus being shed by the different routes that could be ranked, like very qualitatively. Then there is the probability of contact between an infective source and a susceptible animal that will be country-specific depending on the different conditions. The probability of the susceptible animal developing infection and being infectious is also dependent on the condition of the animal, etc. And the evaluation of the surveillance options according to feasibility and the risk of missing the infection early. So, for example, so for example, if the routes, we are considering the transmission, direct contact with infected animals, okay, there is a lot of shedding of virus in this route, so you would expect that there is a high chance that there is an effective contact, but it will depend on whether the animal, for example, is symptomatic or not, whether the animal has developed antibodies, although the antibodies for African swine fever are not neutralizing, but they definitely influence the clinical course of the disease. And actually, it's important to notice that for any of the routes can lead to either symptomatic or asymptomatic pigs. So in a invented kind of assessment or scenario, we would imagining that we start from wild boar to wild boar infection. There are different transmission scenarios that can be ranked differently, so these vary depending on who's getting infected. So, for example, if we rank that for wild boars, it would be a higher risk to have concentration areas or intra-herd transmission. Then, for example, from wild boar to farm transmission, contaminated feed might be the most important route, and so on. And from each of these transmission scenarios, we can consider the different control options for each of them. We have to consider the control options because then when we get to the evaluation, we need to assign to compare the costs of each of these with the costs of the surveillance effort. So then we would pass to the surveillance options, and then we can actually, this is a simple exercise, qualitative exercise, just attribute, and there's methods to make this quantitative as well. We would evaluate with which of these are we risking missing the infection, which of these are logistically more challenging, which of these are extremely costs that are not even worth attempting for it, and so on. And if we do this exercise just qualitatively, it's clear that for African swine fever, both of these are equally important, live animal testing and dead or symptomatic animal testing, but for early detection, but of course it will depend on the threat at origin. And when this scenario is implied, is the most costly and difficult to get rid of. So for this talk, I would have loved to go more in depth about how to do this ASF surveillance, but actually we have recognized that at identifying areas at higher probability of exposure and the probability of becoming an index case, there is still a lot of work to be done or to be standardized across the European Union. So we have to work on to stop discussing whether we perform passive or active surveillance and actually get at the rest of the steps to get this risk-based ASF early detection surveillance. Thank you.